Very good evening, Zimbabwe. This is Studio 7 Live Talk. We're broadcasting to you from Washington, D.C. this July the 9th, 2020, where tonight I'm actually broadcasting from my home in Washington, D.C. because of the coronavirus, the COVID-19 pandemic currently sweeping the whole country, and in Zimbabwe, where we've seen figures increasing in the past few days. So we're going to be looking at those issues and also looking at the impact of these increases on women. Star.
Yes, and also coming in is Thandekile Mhlanga here in Washington, D.C. And talking of cases, we noticed that Zimbabwe had record cases from the latest Ministry of Health reports. That was 98 cases which were reported yesterday. And out of these 98 cases that tested positive, 47 were actually local cases, which shows that it's not just about returnees, but people in the country also are spreading this coronavirus amongst themselves. And also, although 28 was from South Africa and one from Swaziland and the others from other neighboring countries, which is bringing the total number of the cases in the country to 885, although there are only 670 cases that are active because some has recovered.
There is a bit of good news on the recovery end. We have 206 people that have recovered and 9 deaths. But to help us look at this issue, we have a doctor who's actually here with us, who we asked actually to step out of his surgery and come and help us to look at the situation in Zimbabwe and what's going on. Dr. Simbisoranga, welcome to the program.
Hi, Marvelous. Thank you. Thanks for having me.
Yes, we're taking a look at what's going on in Zimbabwe. We've seen, the increase in just the few days that we've seen with total cases going up, as what Star said to 800 and above. What's your, what do you think is going on at the moment?
Marvelous. It's very unfortunate that COVID-19 is still going out in the community. So we are seeing more cases at a time when the world was hoping to be relaxing. So that's kind of unfortunate because it means we haven't been able to control the pandemic as we had hoped. So we worked on timelines, but in terms of the virus itself, like someone said, it determines what everybody else will do eventually. So unfortunately, the numbers going up is not a good sign. It means that, number one, it's spreading in the community. Number two, hopefully we are testing more so we get to find out who is infected and who is not. So that's very concerning, especially for Zimbabwe right now when it's winter time, when it's easy to spread respiratory infections like COVID-19.
Mumbotaura nerurimi rwamai kuti munoona sei zviri kuitika pari zvino tichiona kuti tiri kuona kuti munyika pari zvino dambudziko reCOVID-19 kana kuti coronavirus munyika tiri kuona riri kuwedzera. Zvinorevei izvi pari zvino?
Chazvinotaura Marvelous ndechekuti tinenge tava nguva yakaoma. Kana ndichiti panguva yakaoma, it means that my numbers kukwira is zvinoratidza kuti ari kuenda the wrong direction. Anofanira kunge ari kudzika. Saka kana ari kukwira, it means vanhu vakawanda mucommunity muZimbabwe vari kubatira chirwere. So it means kana mune vanhu 800, those 800 pamwe vari connected to another 5 each. Who they can easily spread the disease mumafamilies avo, kana kuri kumabasa, kana kuri kumachechi, kana kuri mutown mumangoenda vanhu kunoshopa. So it means chirwere chiri kuenda the wrong direction. Tinofanira kunge manumbers ari kudzikira, not kukwira, kuti tisaramba tichiparadzira among ourselves.
Star, I don't know if you have a question for the doctor.
Kulabo ke abasanda ukusixhuma kathesi kuhlelo lwethu lwanamhlanje ke sixoxa ngodaba lwe-coronavirus. Namhlanje ke sinanzelela ukuthi kwele Zimbabwe abantu asebelegcikwane leli sebengamakhulu ayisitshiya adlula ayisitshiya kalombili i-885 njalo sinanzelela ukuthi izolo kodwa nje kulabantu abafika phose ikhulu abaficakale belegcikwane leli i-98. Ngakho-ke yilo udaba esilicubungulayo lolo ngoba i-98 leyi siyananzela ukuthi esikhathini esedluleyo bekuthiwa yilabo abavela kwamanye amazwe anjengabo-South Africa labo-Botswana lemanye ababuya laleli gcikwane, kodwa sesinanzelela ukuthi hayi labaselizweni bazithelelana leli gcikwane ngoba abangama-47 i-47 kukhanya bebengabaselizweni, njalo sinanzelela ukuthi kulabongi labongikazi abatholakale belegcikwane leli esibhedlela sempilo lese-United Bulawayo Hospitals. Ngakho-ke lokhu kwenzakala wona emhlabeni jikelele igcikwane leli lokhu limemetheka, lelizweni elingumakhelwane i-South Africa limemetheka ngesiqubu. Ngakho-ke lokhu sokungani kuyethusa abanengi. Yikho-ke silo dokotela lapha emsakazweni wethu, uDokotela Simbiso Ranga, osichasiselayo ukuthi-ke kuhamba njani, ukuthi kungani amanani lawa elokhu eqhubeka eqansa. Ngakho-ke sizambuza-ke ukuthi kuhamba njani lapha-ke bese silitolikela. Dr. Ranga, coming back to you, do you think the efforts that made by the government on testing, do you think they are enough or there is more that needs to be done?
Thank you, Star. I think more needs to be done. Absolutely. We are a population of about more than 14 million. And from what I understand, I don't think we have breached 100,000 testing even. And the only way we are going to know how bad the pandemic is in Zimbabwe is if we scale up testing. That way we can then figure out in terms of contact tracing, in terms of what people need to do in families, at the community level, because some communities are affected more than others. So you need a very surgical kind of approach where we say where is the problem and what needs to be done at that level. What should everyone in the community be doing to reduce the chance of spread?
Yes, what about behavior and social responsibility? Do you feel that the people need to do more not to spread this disease, or they are following the guidelines for the social distancing?
Sure. That's a very critical question. The reason why it's critical is the fact that life should go on even when COVID-19 is going on. So the question is, how do we coexist? The initial hope was that, with lockdowns and everything, we cut back the number such that we can then manage the few who have the disease. We can do quarantine and we can do contact tracing more easily. From the look of things in a lot of parts of the world, Zimbabwe, South Africa included, I think now people are trying to strike a good balance between how to contain the COVID-19 at the same time life going on at a new normal. So the new normal for that to happen, because we have an economy which is in the toilet currently, and without any economic activity, life is going to get more miserable, particularly in Zimbabwe. So what needs to happen is that whatever activities we're going to do, whether that's going to church, whether that's going to work, whether that's going to school, whether it's funerals, all those kind of activities, people have to practice safe COVID behavior, what I would call COVID-19 behavior. That includes things like wearing face masks, which have been shown to decrease the chance of spreading the disease. That will include things like social distancing, the 6 feet, 1 meter. That will also include basic hygiene, no more handshaking, things like elbow greet, using hand sanitizers, washing hands all the time. And if you have symptoms, you want to seek help, get tested early. I mean, anybody who is concerned about the disease, they think they might have it one way or the other, they should get tested early. That way we know who has it and we take whatever measures are necessary. So I think that people may be kind of relaxing because this has been going on since February, March, and people can't wait for life to return to normal. But until we have a vaccine, the new normal is not what we were used to before February. Thank you, Star.
Thank you. Yes, thank you for that response, Marvelous.
Tomboenda ipapo chiremba ndombovhunzaini kuti sekutaura kwaita Star kuti saka zvii tinoona kuti tiri kunzwa kuti community spread iri kuti wandei munyika pari zvino. Zvii zvingaitwe nevanhu tichitarisa kuti vazhinji vanga vakavharirwa uyezve vasina cheruviri. Zvamataura imi kuti new normal yacho chii?
Saka new normal Marvelous ndeyekuti pese patiri tinofana kufunga kuti inini kana shamwari kana hama inokwanisa kunge ine chirwere isina masymptoms. Saka kuti tese tidzivirire chirwere tinofana kuti pese patiri ngatipractice safe behaviors, which means that kana patinobuda mumba paya haubude usina face mask kana chekuvhara mhuno nemuromo, because I know everybody might not be able to afford my surgical face mask anoti dhurei. Saka zvinhu zvatokwanisa kushandisa kuvhara muromo nemhuno kana ari maclothes akachena, let's do that. Let's do social distancing kuti tisagara padhuze nepadhuze wherever we are, kana kuchechi kana kumabasa kana mubhazi here. The same attitude has to be adopted. Ndo zvinokwanisa kutibatsira kuti chirwere chisaramba chichipararira. Vaya vanofunga kuti vane chirwere ngavanotestwa. Hurumendewo ngaiite kuti matest ave more available for the ordinary Zimbabwean, not just for those vabva kunze kwenyika, vaya vari quarantine centers. Thank you, Marvelous.
Tombotarisa kuti imi kuti mutouya pachirongwa manga muri kubva pabasa, muri ikoko kwamuri kushanda, mune makaita sei, mune munoshanda sei savana chiremba?
Sana chiremba Marvelous, muchipatara umu taakutopfeka face mask all the time, whether uri kupinda murumu ine munhu ane COVID kana asina. Tinenge takapfeka goggles. I might have some of that stuff here. Let me see. I think saka face mask, of course, vatereri, they have seen that before. If you give me a second. So this is the new normal for us, Machiremba, Nema nurses. So you have your face mask, you have my goggles. I will show you. Sorry, it's kind of all over the place now. Okay. Now you can see me clearly. I know it's a little bit messed up here. But the point is, this is how I spend the whole day in the hospital, the 12 hours that I am there. Wow. Now, if I need to go into a patient room and a COVID-19, one of our N95, this one.
Okay.
So you would put that underneath the face mask Ramaona Ria. So sometimes, I'm just telling you what this means for us. So mukatarisa magoggles angu atova mist. Because they somehow, kufema kuya kwatiri kuita mhepo ya inoti dziyei ikaenda pamaglasses apa yosangana nechando panobva paita mist. Saka pamwe kuona kune kwakutonesa. But that's what we need to do to minimize the chance of spreading the disease or getting the disease in the hospital setting. And I'm gonna take off the face mask and the goggles. Okay. So it's such an inconvenience for everybody, but this is how we're gonna reduce the chance of spreading the disease. And for the community, of course, avasi muma areas ekuti you can spread the disease with the same density. So my face mask is what is recommended in public.
Let me bring up Star because you've got a few minutes before we let you go. Star, sure. You saw there the doctor showing us, the combat that they have to put on when they are going into, those areas where people are affected. But doctor, we've seen that in Zimbabwe, maybe PPE is not readily available. So what's your take? When we see the figures rising, there are also strikes in the country, the nurses are on strike and stuff like that.
Is idambudziko chairo Marvelous. It's zvinonzwisa tsitsi. Nokuti kana ndiri chiremba kana nesi It doesn't matter kuti ndiri muZimbabwe, ndiri kuAmerica, ndiri kuUnited Kingdom, kuti tichengete vanhu vane COVID-19 zvakanaka, isuwo tinofana kunge tisingabate chirwere. Saka kuZimbabwe kusatova nema-personal protective equipment, it's a very big problem for ma-nurses nema-doctors, and it's a problem for ma-patients, for everyone. That should not be acceptable, because it means those doctors and nurses, they are exposed. And that exposes not only them, their families, the patients they take care of. So that's something that needs to be addressed quickly.
Star.
Yes, and I'm sure some would like to know what they should do if they have the basic symptoms, or what's always being listed as the symptoms. Which ones are those symptoms, if you can just tell us, and what to do when they think they might have contracted the virus?
They might have contracted. Sure, Star. So the first thing is, a lot of people run a virus, they don't know it. So that's why it's very important for everyone to practice social distancing, nema face mask. The next question is my symptoms. My symptoms. My signature symptoms are respiratory. Ndeye muchifuva munhu anokosora, kurwadziwa mabayo, kuita fever, vamwe vobva vaita sneezing, vamwe vanotaurawo nyaya yekuti vanoluza sense of smell, vamwe voita mudumbu, vamwe vanongonzwa kuti muviri handisi kunzwa zvakanaka, vamwe vanenge vachipisa votonhorwa, vachipisa votonhorwa. Those are some of the main symptoms ekuti vanhu vanoita. Saka what should you do if you have my symptoms? You should seek medical help. I can't speak specifically kuti ma protocols in Zimbabwe akanyatsa kumira sei, what number to call. I think pane ma numbers, but of course une number yachiremba wako, you should be able to call the office and say, I have a problem. They can direct you. But I would seek help early.
If you can say the same thing in English so that Star can translate.
Oh, sure.
Yeah.
Thank you. So as it pertains to COVID-19, a lot of people don't have any symptoms at all, but they can spread the disease. And that's why it's very important that everyone practices safe COVID-19 behaviors when they are in public or at home, where we wear face masks, we do social distancing, basic hygiene. That should be practiced everywhere. So it is very important for the government, for everyone to increase testing. That way we can find out who is infected, who is not. For those who have symptoms, the symptoms obviously include respiratory symptoms, which are the main ones. Things like coughing, shortness of breath, chest pain, sneezing, fever, chills. They can also have other symptoms like losing the sense of smell, diarrhea, just feeling unwell, which can be general. So the question is, when you have those symptoms, what should you do? Seek medical help, which means that you can call your doctor, let them know what's going on, and you tell them you are concerned about COVID-19. That way they can triage you appropriately. So there are protocols in Zimbabwe. I'm not up to speed in terms of what number you call and so forth, but your doctor would know that. Thank you.
Yebo ke sibongile ke udokotela lapho besichasisela okuningi ngalolu ngalo ugcikwane le coronavirus ukuthi ubona njani impawu zokuthi ngabe sele kuhlasela okunjengokuthi imula, ukubulawa yisisu, isifuba, kusisu esigijimisayo lokunye nje okuningi lokuthi abantu bengazivikela njani.
Maybe Star, before we let him go so that we can continue onto our program, is there any statistic that shows whether there is a divide of whether women are more susceptible to COVID-19, or what's the gender bias when you look at COVID-19?
Thank you, Marvelous. That's a very important question. What I understand so far, the virus is not discriminating between gender, male or female. It seems like both genders are equally affected. Obviously, now the question is who is out there, who is at a higher risk.
Mm-hmm.
So within communities, you might find that women may be getting together, for church purposes, things like that. As long as you go out in public, where you can interact with other people who might be infected, it increases the risk of catching the virus. And in terms of what matters, the gender doesn't matter as much, but people with comorbidities, the older population whose immune system may be compromised, they are more likely to succumb to the effects of COVID-19. Thank you.
Maybe mukataura neshona tobva tatsimuende zvenyu.
Sure. Thank you.
Pane umbo here hwekuratidza kuti madzimai vangangowanikwa vachibatwa neCovid-19 kupfuura varume kana kuti ava vatema kana kuti vachena. Pane umbo here kana kuti zvakamira sei pane zvamuri kuona kunzvimbo dzamuri ikoko?
Zvatiri kuona Marvelous ndezvekuti COVID-19 haisi kusarudza pakati pevarume nemadzimai. Panewo vekuti zvinobva nekuti unoshanda kupi, uri kuenda out there here, vamwe vari mudzimba. Saka ndo zvinodhitemena kuti anobata chirwere ndoupi asingabate ndechikubata, hachisi kusarudza whether marudzi, whether kuti madzimai kana varume. Asi zvatinoziva ndezvekuti vaya vane zvimwe zvirwere atinoti macomorbidities like diabetes, high blood pressure or hypertension, asthma, emphysema, zvirwere zvakadaro zvinoita kuti kana wabata COVID-19 you are likely to suffer more, vamwe vachishaya compared kune vaya vasina some of those comorbidities.
Aiwa, tinotenda Dr. Simbosaranga, tinotiziva kuti muri kumhanya, muri pabasa, saka tinokutendai chaizvo.
Thank you, Marvelous.
Thank you.
Thank you for having me. Have a good day.
Thank you. Aiwa, apo tanga tiri kunzwa kubva kuna Dr. Simbosaranga vanova chiremba imo muno muAmerica. Pari zvino vanga vari kutomhanyira kuenda kunoita mamwe mabasa, asi tati vambouya timbozeya panyaya yedambudziko rechirwere ichochi cheCovid-19 star.
Yes, Mav, we are expecting Makodonga Mahlangu, activist of women of Zimbabwe, arise. Somehow we might try and check her. She says she can even hear the doctor talking.
She's here, but there's no picture. Her screen is blank. So okay, I'll put it up so you can speak to her. Maybe she can hear you and answer you. Let's
yes, can you hear us, Mahlangu?
Yes, I can hear you.
Wow.
But you don't have a picture. You're black. You're blank.
Yes. I think I was having challenge with the picture on. I couldn't hear.
Okay, go ahead and go ahead.
Yes, and Mav, there's a picture I forwarded to you. You can check. All right, you can go ahead. You said you heard part of what the doctor said. And what do you think is on the ground now? Do you think people are practicing social distancing, or there are many challenges hindering them?
People are aware that they are supposed to practice social distancing, but there are a lot of challenges. For instance, right now we are talking about the issues of water shortages in Bulawayo, the issues of food in the households. Women in particular and the children have to go and queue for water as early as 5 a.m. You see them around boreholes, or as late as 7. They are still queuing, waiting for water bowsers. Right now, the city council has tried to provide water kiosks, but still the social distancing is a challenge because they are trying to get a hold of the water that comes in short supply. So there's always pushing and shoving. And in times we have experienced fist fights in these boreholes. So it's a challenge. People understand, but then the necessity to get those services like water and food. For instance, meal comes once in a while. You have to queue, you have to push and shove, all these things. They come into factor.
And in all this process, do you think women and children are having it tougher than their male counterparts?
Definitely, and I will say why I'm saying that is that because most times when there is crisis, normally the women and the children carry the burden. Like I've just alluded to, the situation of water and queuing for basic communities, you will find mostly is women and children, and they will spend longer hours waiting. But the moment that commodity comes, let's say it's milli, then the young men and the youth will just come and push them off the line. So they're always exposed to these things, but they always struggle to get all these basic things that are needed in their lives, but nothing is happening for them. It's a crisis. Yes.
Okay, you can continue. I wanted to say generally, what do you think about the government's preparedness? Do you think there was enough time? Do you think more can be done, or is it inevitable?
Honestly speaking, I think Zimbabwe has never been prepared for the lockdown. We're just copying and pasting from what South Africa is doing. If Ramaphosa announces something, then the next thing will say, okay, copy and paste, we do it. But we neglected the key thing that the South Africans did. They resourced their people. For instance, you are seeing in South Africa, the food packages that were given to people, there were grants given to people. In Zimbabwe, nothing happened. They tried, I think, 1 week in April where they came in, they went to Njube with the milli, I think it was the subsidized milli. It was a once-off thing, but other areas never benefited that. So I think we are ill prepared. We're never prepared. We are only prepared with the announcement, but not helping the people on the ground.
Yebo ke ungasitshela ke ngesintu ukuthi kahle kahle singathini ngohlelo olusaqhubeka lockdown sikhangela ukuthi igcikwane leli ele COVID-19 liyamemetheka akuthiwa ngama local transmission abantu sebethelelana phakathi kwelizwe akuseyilabo abavela phandle kwelizwe kuphela. Ungathi kwenzakalani elizweni lapha kunengi okwenza abantu bethelelane leli gcikwane yini nxa kuyikuthi balala?
Igcikwane leli likhona ngani ngoba siyabe sesifazile aba-test positive. Okwenza abantu bathelelane kakhulu ukuthi i-lockdown ungahlala endlini ungela kudla ungela amanzi ayakuforsa ukuthi uhambe njengakathi sikobulawa siphila ngesibhorane ama-water bowsers. Khona ngalo kuyabe kuyivikoroni ngokuqala ukufika ungafika sulayini ngamabhakede isibhorane sona ngokwaso nxa sipompa lawo manzi kasigeziswa siyabanjwa laba msana 3 ngapha silenge kuso asila ama-mask asila sanitizer asilani kusemalokishini lapho sifuna uthola amanzi sihambe ngekhaya sithi yebo sikubonile sisuke lapha siye kuthiwe impuphu iyabuya kumbe itshukela liyabuya nxa usenelisa ukulithenga uhambe emagrosa ufike ulayine lizaqeda lingomama labantwana liyabe liselayinini kukuhle liyabe salilandela ukuthi umzila kuhle. The moment impuphu leyo nxa ifika ulutsha ikakhulukazi abafana batsha ivikoroni bayaliphusha bayaliwisa liyalimala liyathintana umkhuhlane uyawuthola. Ubusisike bakhangela ukuthi kulabo mama abaphila labantwana abalamagcikwane kumbe bona balegcikwane lengculazi HIV bahamba bayitshona esibhedlela lapha kade kutholakala khona uzothi abaphendukile kabatholanga lutho. Sesikhangela yona indlela esihamba ngayo i-mode of transport kule Zupco qala nge-lockdown i-first month ye-lockdown ama-Zupco hayi social distancer kade saseloda full capacity. So ama-chances of getting i-COVID vele siyayithola khonapha eZimbabwe siphila ngomusa wenkosi.
Yes, and as an organization, Women of Zimbabwe Arise, is there anything you are doing concerning to do with COVID-19? Any awareness programs in education sectors or in just informing the people?
Yes, we are doing a lot on COVID-19 awareness, especially in the rural areas. We've gone to where we're advising them that they because we are in Matabele and mostly we have borders like Botswana, Plumtree border and Beitbridge, where we are seeing influx of illegal cross borders, and those are coming through the borders. Those are coming through, and people that are escaping from the quarantine centers. So we are warning them, saying, even if it's your child, even if it's your relative, make sure that you don't just allow them to the house, to the homestead, because you're enhancing a danger of contamination. So these are some of the things, and we're also giving them, providing with some sanitizers and the mask, because they don't have this thing. And when we advise them that when they go to the boreholes, the source of water is in the rural areas, they should try and maybe not go at the same time the entire homestead or this village, so that they avoid these chances of getting COVID. And then in the terms of education, we are really stressing that they should make sure that when they allow their children, when the schools open, they should always, when they hear that the pronouncement, because there's no, the one thing, there's no consultation on schools opening. It's just pronounced. It's like examinations when they're pronounced, that the national examinations were going to be written, no resourcing again. So now we're going to the communities with the guidelines and say the World Health Organization guidelines state 6 guidelines of the reopening of schools, what should be in place. It should be at local level, at village level or district level. That preparation should be done. So we're warning them against this. No, you should refuse and say you can't allow your children to go. And the other thing that is we're advising our members, citizens in the communities, that the government, the Ministry of Education, is expecting them to pay second term fees, the user fees. No one went to school. And moreover, it's a violation of the Education Amendment Act of 2020, where it says now it clearly defines what is state-funded education. State-funded education is ECD to Form 4. So we're expecting our children to go back to school, and it's now even a demand, because under COVID, the sources of livelihoods, most of Zimbabweans depend on informal trading. That has been ceased working because of the lockdown. And then we're also mostly relying on the diaspora remittances. That is not happening because the very people that were providing such relief to the families, they're under lockdown in those countries, or they've come back home. So we have the challenge where the Minister of Education is expecting parents to continue funding the education system despite the COVID pandemic crisis that have affected people. And to worsen the
image. Before you continue, you brought an interesting point there, that you are conscientizing the community that according to the WHO standards, how schools are not ready to be opened, and especially in those, you are also talking to those who are in quarantine or running away from quarantine centers. How are you received in these communities?
In most communities, people really appreciate that, because they are saying they had no idea that when someone is coming back, is supposed to go to quarantine. They do not have that information, and I'm glad to say, especially in my Topo district, we have seen people compliance to that. Even at funerals, they are now sanitizing the shovels, whatever the tools they use for the funeral. But in other places, we've gone to. People had no idea, especially the San community. We've been to Cholocho. The San community had no idea what COVID is, and if something like a pandemic. So those are the challenges that we are seeing, that we are, as the pandemic has been here since March, the lockdown. Some people are just going on as normal, which means they will die not knowing what is killing them.
Yes, when you are talking about education, did you talk to the government, the Minister of Education? How far are you going with this schools opening issue?
We are still engaging and will continue engaging. If the engagement fails, we will mobilize people to just boycott sending our children to school, because we cannot experiment with these children. And we are looking at a situation where these children are already starving home, so their immune system is already very weak. And because I'm talking about children who have families that go for days without meals. I've had, also is a toll-free line where children are able to phone us and say, they're always asking, so when are the schools opening? Then we say, no, the schools will open after these conditions are met, so we cannot talk about the dates. We need to talk about what is on the ground. And then they will tell you that my grandmother or my mother is saying, I'm not going back to school because we don't have money to pay. So that's when we are bringing in the Education Policy Act and saying, you are supposed to go to school. It's now even an offense for a parent to keep a child at home. So these children, then they tell us that they've gone for days without meals. And then they are telling us they want to go back to school because they are tired of queuing for water or being sent to sell whatever, tomatoes or sweets in the street to try and make money despite the COVID pandemic. So we are very concerned. We are caught in a tough situation as people who advocate for the right of children to go to school, knowing that, yes, when the children go to school, there's this challenge of that they are already starving. Their immune system is very down, which means we are now advocating for the government when they open school, feeding scheme should commence. Everything should be touched by the government.
Yes, singabuyeli kumavela sike ungasitshela ke ngesindebele ukuthi lithi kahle kahle uhlelo elitshela abezikolo yiluphi namafitshane.
Ezikoleni lapha abesikole sibatshela ukuthi khona kulezi nqumo kulemgoqo okumele ibe khona ukuze izikole zivule. Asikhulumi ngama dates, kumkhono kumele kulungiswe, and lawa izinqumo lezi lemgoqo le esinqandayo ivela kwinhlanganiso ye World Health Organization ekhangele ngezempilakahle umhlaba wonke jikelele ukuthi nxa izikolo kumele zivule senjani. So yikho sikutshela khona abazali ukuthi khona asikhulumi ngokuthi khona izikolo zivulile labantwana kumele benanzelele ukuthi lokhu khona into ezinganga ama mask, sanitization, lokuthi amabhuku asozeshe, lokuthi sona isakhiwo seclassini bayenelisa yini ukuthi kube le social distancing, lokuthi ama teachers aze nxa kungaba lo mntwana opositive kumbe ogulayo bamenza njani, bambeka ngaphi, ngoba into ezifunakalayo zinalezi lokuthi ama temperatures a-checkwa yini. Okubuhlungu ukuthi lezo zinto kazi khona ngoba sinanzelele lakathi siloko sigijima ngokubhala kwama exams ukuthi ezinye izikolo bezingekho. Ngiyathanda ukubonga kakhulu ukuthi abanye o-PD o-provincial education directors ade sikhulumisana labo kakhulukazi eMathebeleni ngapha bebehle bakubona masinye ukuthi bayagijimela kulezo sikolo bakubeke bancedise ngalokho okushotayo. So ibudlelwane qhubeka sisebenzisana labo lohulumende ukuthi sabantu le Ministry of Education sabantu lokhu kakukho ngangcono kumiwe, kodwa kungehlula lokhu sizayenza esijayele ukwenza njengenhlanganiso ukuthi hayi okukhuluma sokwehlulile sokumele sitshengisele, kodwa ngesikhathi seCovid bengasosikhathi sokuthi sitshengisele, kodwa ngenxa ukuthi ukutshengisele sizakwenza maybe sizahlangana lama teachers union bahlalisa ama teachers ezindlini lathi sihlalisa abantu abathe ezindlini, ngoba angeke sifake impilo yabantu abethu ezingozini. As much as we want them to attend school, want the priority ukuthi babe safe, le frame of mind yabo babe secret.
Yebo ke hayi kuyezwakala olendlebe sokuthwa uzwile marvelous.
Aiwa apo tanga tiri kunzwa kubva kuna mai Magodo Ngamahlangu vachitaura ivo pamusoro pezvavari kutarisana nazvo sesangano reHoza, vachitaurawo nematambudziko ari kutarisana nenyanya vana vari kuda kunge vari kudzokera kuzvikoro panyaya yeCovid-19, vachiti ivo chikuru ndechekuti vana kana vachinge vakudzokera kuzvikoro vanofanira kunge vachienda kuzvikoro vasina kutya kuti vangazobatwe nedambudziko irori reCovid-19. Tiri panyaya iyoyo pane mumwe mudzimai wekuVictoria Falls vanonzi ivo amai Lydia Zulu vari kuwanikwa ivo vachibatsira vana vechidiki panyaya yekuwanikwa ivo vachiita zvidzidzo panguva iyo vakamirira kuti vadzokere kuenda kunoita zvechikoro pachavhurwa zvikoro. Regai timbonzwa kuti vari kuzvifambisa sei kwavari ikoko.
Ini ndinonzi Lydia, ndiri kuno kuMonde Village. Tine vana vari 19 vatinavo panapa. Pane project yatiri kuita. Tiri kubatsirana nevana tichivadzidzisa ama subjects sezvo vachiri vasiri kuenda kuchikoro nenyaya dzeCovid, ende havana access yekuti vakwanise kuita zve-e-learning kuno kuma-reserve. Ma-challenges atiri kusangana nawo kunoku ndee-stationary. Dai tatakwanisa kuti tiwane stationary, tawana maboard. Community yakatipa land yekushandira, asi hatina ma-resources ekuti tikwanise kuvaka class yekuti chero kana zvikoro zvazovhurwa tikwanise kuti vana vapote vachiita ma-lessons kana vabva kuchikoro. Vanokwanisa kutibatsira paproject iyi tingafare chaizvo. Rimwe dambudziko ratiri kusangana naro kunoku nderekuti dai tatakwanisa kuwana vanotibatsira neporridge, tawana hupfu, tawana dovi neshuga rekubikira vana kana vapedza zvidzidzo zvavo. Zvimwe zvinhu zvatiri kuchemera kunoku kuti dai tabatsirwa ndezvekuti dai tanga takwanisa kuti tiwane vanotibatsira nelaptop kuti tikwanise kubata zvimwe zvidzidzo zviri kuitwa pa-e-learning. Ini ndinobatika pa263 774 749901. Ndo pane namba dzangu dzeWhatsApp. Pane vachabatsira tinotenda.
Aiwa apo tanga tiri kunzwa isu kubva kuna Mai Zulu vari kutaura ivo kuti vari kutsvaga rubatsiro rwokuti vabatsirwe panyaya yekuti vana vavari kudzidzisa vawanikwe ivo vachipiwa chikafu. Regai timbotora muzvare Magodonga Mahlangu. Vamai Magodonga Mahlangu, manzwa zviri kutaurwa namama avo. Vari kutaura ivo kuti vari kubatsira vechidiki vari kunzvimbo yekuVictoria Falls panyaya yekuti vakwanise kunge vachiita zvekudzidza nezvimwewo. Imi mataura zvakare kuti muri kutarisana nedambudziko rekuti vana vari kutarisana nenzara panguva inoi. Mungaone sei zviri kuitwa nemadzimai aya?
Chinhu chakanaka kuti paite kutaro pati tirinyanya tiona kuti hazvigoni kuti upatsire munhu wese. Izvi zokufita vana kudzimba zinota ma-home feeding things, zinota ma-resources and the safety kuti kudya kwacho kuri kupikirwa papi, because chinogona kuti chikanganise futi utano hwevana kuti maybe chakapikira kwacho tinogona kuti kunyanye kuti kunyanya social distancing kunyanya maybe kufalse apa ari kugara mama uyu maybe ane population yakaiti maybe a few population, but here in high density suburbs in Bulawayo there's everyone is starving, vanhu vakawanda vari kustarva, so haugoni kuti upikire. I'm sure kana upikire line yako munhu wese ouya, so kune challenge. That's why maybe the government should have put in place a situation where there's feeding during lockdown yevana kuzimba, maybe allocation by schools, and say give, I don't know how, but this is something that was supposed to be done, and that's why we are now advocating that when schools open they should be feeding. Failure to that, we are putting our teachers at risk, and we are putting we are really torturing the teachers to teach someone who is starving, and they can't do anything about that. So there should be feeding programs where in such times of distress, whether it's at school or at home, like we are seeing other countries where there are food packages. Nothing is happening like that.
So as was at Zimbabwe at the moment, what kind of programs are you undertaking when you talk about, there is a need for feeding programs? Have you approached the government, and what are they saying?
We have, before even the pandemic started, we were already petitioned Parliament, the Education Parliament portfolio, the Parliament portfolio on education, about the school feeding scheme, because there was already a crisis with the feeding scheme where parents were expected to fund the feeding of the school. And then we petitioned the Parliament saying, no, government should be providing that. Because we're saying the objective is to alleviate poverty and economic hardship that parents are facing. But if you are then asking parents to contribute, and then the meal is as cooked at school, you are no longer addressing the poverty. It's like you're saying parents are lazy to cook the meals that they have in their homes for their children. Hence, they should bring it to the one place and cook. So the petition was well received by Parliament, and then we're supposed to do school visits, because what is happening in schools, we're seeing that they're supposed to bring grain, they're supposed to bring relish. In other places where they will get grain, maize grain, there was no relish. So we're going to visit. So now we've carried on with that petition, and we're saying we want to do home visits, and then it will be fact finding mission where the Parliament portfolio Education Committee parliamentarians will go and say, we went to this homestead, they interview with them using their template of survey, and how many meals do they eat a day, what are the meals, is it, and then so on. And then we say, that's why we are advocating for the feeding at school and at home, because we are seeing this challenge now.
Also, maybe before I let Star take over, so have you changed your focus from working from women? You're now working with children. What is going on there?
It's a holistic approach. You are still working with women and you're working with children. Yeah.
Okay, Star.
Because yes, we started working with children because we're seeing a gap where women are tormented because when they have not paid school fees, they are harassed. Some were even sent to police. making like payment plans with police, or they are punished. The humiliation that women were going through. If your child does not pay, you come and work at the school, and then that also embarrasses and dehumanizes your own child. So we are now tasking both things. Like when the education burden falls on the mother, if there are any payments in material needed in school, is mad. So now that's why we are holistic approaching what the human rights and the education rights. They're also going to be moving to the health sector, because we're seeing now there's that challenge again. And the lockdown also saw us moving into a direction where normally we're just referring to Msasa project, the domestic violence. But now we've been heavily involved because of the lockdown. We're seeing that the normal sister organizations that deal with the domestic violence, they were being overwhelmed. So we're working with them. So we've now ventured into domestic violence.
Aiwa, apo tiri kunzwa kubva kuna muzvare Magodonga Mahlangu vesangano reHoza vari kutaura ivo kuti panguva ino yelockdown vatoona kuti kunyange vanga vakatanga vachishanda nemadzimai, vakushanda zvakare nevana panyaya yekuti vana vazhinji vari kutarisana nenzara, uyezve madzimai ndiwo vanowanikwa ivo vachizowanikwa vachibata dambudziko irori kana vana vakadzingwa kuzvikoro, panovhurwa zvikoro, kana kuti vana vakafa nenzara. Vari kuti zvakare vari kuona ivo panguva inoyi kuti pane vanhu nyanya madzimai vakawanda vari kuwanikwa vachishungurudzwa mudzimba. Vainge vachimboti vakaona madzimai aya vowawanikwa vachivaendesa kumasangano akadai seMusasa project, asi pamusoro pekuti Musasa project pari zvino mabasa ari kuvawandira, ivo vakutowanawo vachibatsira madzimai iwaya. Star.
Yes, and you did say in Ndebele, Ms. Magodonga, that your organization might join in the demonstrations in solidarity with the teachers if schools open, although you don't want to do it during the COVID-19. What is your view as an organization about these demonstrations? And do you think the message will be carried across in this channel?
The demonstrations are part of a democratic society, but now in light of COVID, we need to be very careful that we don't endanger or expose ourselves or our communities to the pandemic. But at times when you see people resorting to a demonstration, it's the only way to say, you're saying, I have this problem, hence the world should see my plight. Maybe someone is going to listen to you. Because right now we are engaging, we are saying we need this, there's a need. But it seems the authorities or the duty bearers are not taking teachers seriously, are not taking the preparation for the school, reopening of schools seriously. So the only thing that you will maybe get to them is to see how strategically under the new normal we can protest.
Yes, and before you go further, we see that you and your counterparts, Jenny Williams and other women, have been arrested before when you demonstrated. What's your opinion on how women are treated during this lockdown by the police and even those who were arrested when demonstrating? Do you cancel those? Have you had them coming to you? Is there anything you are doing about them?
Yeah, it's one of the things that we are still engaging with the police on that. We actually on the 16th of April 2020, where police beat women, remember the Counterparts incident, and then there were also other people who were beaten. And unfortunately, 3 of our members were in town that day. They were going to get their monies from there. Western Union that was sent to them. So what happened is that these women were attacked and beaten while queuing to get their monies, and we wrote a formal complaint, and then we engaged the police on that. They are still investigating the matter, and as we speak, last week we revisited the issue, and they promised us that they are still on the issue, and they are almost finishing their investigations, and they are about to identify the culprits. So that's why I'm saying when you engage, and then there's a final point where you say, I can't be perpetually engaging when I'm perpetually suffering, and the person that I'm engaging is not responsive. That's when the strategic non-violence of peaceful protests comes in. So we are hoping the authorities will not lead us to that situation where we find ourselves going back to the street and protesting.
Marvelous.
Aiwa, tiri ipapo tiri kunzwa amai Magodonga Mahlangu vari kutaura ivo kuti pari zvino sangano ravo riri kutaurirana nemapurisa panyaya yezvimwe zviri kumabatirwa ari kuitwa madzimai pavanenge vawanikwa ivo vachiratidzira vachitaura ivo kuti shuviro yavo ndeyekuti pasawanikwe madzimai vachishungurudzwa nekuti vanhu vane kana kuti bumbiro remutemo rinobvumira kuti vanhu vaende kunoratidzira. Vakataura ivo kuti pane vamwe nhengo dzebato ravo rehoza mbiri dzakange dziri mudhorobha apo takaona mamwe madzimai vachirohwa kana kushungurudzwa nemapurisa. Saka vari kuti ivo madzimai panguva ino yeCovid-19 ichokwadi vamwe vavo vari kushungurudzwa nemapurisa, asi shuviro yavo ndeyekuti zvinhu zvakadai zvisawanikwe izvo zvichienderera mberi uyezve kuti zvigadziriswe munyika. So Mr. Magodonga Mahlangu, if you can just, I liked the question that Star posed about, the issue of protest, because before we used to know that you were very, very vocal as WOZA, but of late we have not been hearing much from your organization. There is a demonstration slated for July the 31st. Is WOZA going to join that demonstration, or what's your view?
We are not going to, we have not established the objectives, and we've normally as a movement, when we do a bottom-up approach, our issues come from the communities, and then we identify how widespread is the issue, and then we say, is it a Bulawayo dam? That's how at times we'll see that we will demonstrate in Bulawayo because it's a Bulawayo issue, and then if it's a regional issue, it's a national issue, we demonstrate at a national level. Right now, our members have not said anything about demonstration. Our members are concerned that they are seeing the harassment on the street by the police. When they have no mask, they are made to pay, and then they are detained, and then or they're handcuffed together, further expose them to the risk. So these are the things that I'm saying. We're in the dialogue with the police and the authorities, and then the reopening of schools, and then the hunger in their homes, the shortages of water. So right now we're in the midst of engaging the city council, the police, the health department, because of the ARVs that are in shortages. So if our members feel no, we've engaged, now is the time to be heard on the streets. That's when WOZA will go on the streets. So as of 31, WOZA is not involved in that. We have not been part of that planning.
Mungataurawo neshona here kana muchikwanisa panyaya iyoyo kana kuti regai nditranslate. Magodonga Mahlangu vari kuti ivo kuratidzira kwemusi wa31 July pari zvino sangano ravo reWOZA risati ranzwa kubva kune vatsigiri varo kuti vangaenderere mberi. Vari kuti pari zvino havasi kuenderera mberi vachibatana nevamwe pakuratidzira ikoko, nokuti vari kuti ivo nyaya iri kunyanyonetsa ivo seWOZA inyaya yekuti madzimai ari kumbunyikidzwa kodzero dzavo, uyezve kuti mapurisa vari kubata madzimai vachiwanikwa vachivaisa yatingati cheni, vakabatana navo asi vasina magurovhosi kana mamaski, zvinozoita kuti dambudziko irori reCovid-19 riwanikwe richipararira. Vachitaura zvakare kuti nyaya yenzara mudzimba nevana kushaya kwechikafu mudzimba ndo zvimwe zviri kuvashungurudza pari zvino, ndo zvavari kunyanyotarisana nazvo sesangano reWOZA. Star.
Yes, and uke wakhuluma ngodaba lwe-domestic violence lokuthi abanye sebebuya kini ukuzelulekwa ababesiya eMsasa project. Ngobani kahle kahle ababuyayo kini? Lingathi ngabantu asesebatsha, ngabadala, ngabantwana, ngabanjani? Ngibaphi laba abahlukuluza nayo ezindlini?
Ubuhlungu ukuthi sithe siqalisa sibe sinanzelela ukuthi bekungani ngolutsha kakhulu. Kodwa isiqasi lockdown, kodwa khathesi sokuhlangene ngoba uyathola ukuthi abadala, abantu abasikhangela ukuthi yibo ngathi ngabakhuza abantwana ezindlini ngoba balayo umalukazana, uthola ukuthi vele sokuhlangana ngoba kukhanya ngani udubo lusuka khona lapho ukuthi khona. And kule pattern ngifuna ukuthi ngichaze something ukuthi i-domestic violence inanzelele lokhu siqasa udila la ukuthi khona kuba lesikhathi kakhulukazi ukuthi la sesisandelwa ngumsebenzi. manyanga sisiyaphela kumbe kasokumele kushoda ukudla endlini kumbe kasomele ubhada ama-bills angikwazi ukuyikho kodwa sinanzela ukuthi khonapho maye sithi 25 to 5 of the next month, that is a peak period of domestic violence. And into ehluphayo kakhulukazi ukuthi khona omama nxa sebefuna ukucela ama-peace order kube protection order ukuzibhale kumele babhadale imali engange-55 bond emapholiseni ukuthi bakwenzele lokho. So esinegotiate ngayo le khona ukuthi angeke ngithi ngivele ngitshayelwe ukuthi endlini akula mali ukusithi mina nxa sengifuna ukuthi ngizothola i-peace order kumbe protection order ngibe sengitholakala ukuthi ngibhadale. So ngezinye izinto esikhuluma ngazo zona ezokuthi khona kumele i-government ethinanzelele ukuthi khona ngivele ngingumama ngitshayelwe ukuthi angila mali sengifuna ukuvikelwa so kumele ngidinge enye imali ngoba kwamanye ama-cases sinanzela ukuthi khona lo muntu wachaya for good 3 months wangikhona sekulayelwa ngomunye ukuthi hayi kule woza uhambe maybe woza ngawuncedisa ngoba ngale kwakulodwende lapha inhlanganiso esijalo uhamba khona abathi esiyahambisa khona abanye abanjengomsasa. So yikho kunanzela ukuthi khona ngezinye izinto nezithi ngathi zifuna i-common sense ukuthi akube le priority singajahi ukuthi khona kumele ubhadalele khangela njengokuthi impilo vele ngifuna ukuyivikela kathesi ngenjani lokuthi nxa abantu lasebechayo so kumele bayizibhedlela ngoba sithwale nzima sigcina abanye sibahambisa ama-private hospitals ngenxa ukuthi khona ama-public institutions kade sakhangelane ngegcikwane. So akudingakali ukuthi si-overwhelm ama-health institutions ethu ngenxa ukuthi endlini kulokuchaywana okuchayana hayi bavivinyana nje yonke ama-age groups.
That seems like quite a huge issue if some of the women have to be taken to hospital. If you can summarize to us in English again on what exactly happens here, who are the people who come for counseling on domestic violence and their reasons and the challenges you face on...
Initially, yes. Okay. Initially, when we started dealing with domestic violence, we realized it was the young groups, maybe the youth, those are recently married, but now we started dealing with the middle age, and now it's cutting across. It doesn't matter whether it's elderly, it's the young women, the young couples. And the challenge that we have been seeing is that when we advise them to go to the police station, because these meetings will be consciously happening, and then at the police station, there is what we call, when they want the peace order or protection order, they are supposed to pay $55. And the majority of women did not have that. And we realized that there is a pattern in this domestic violence escalation. When it's month end, let's say the 25th to the 5th of the next month, that period is a peak. And then when you are talking to the women, they will say that maybe they've run out of the basic commodities like meal or the sugar finished or something, or the bill, especially the tenants, the bill will be, the landlord will demanding payment for the rent, and then we ask the husband, or there's no money, then the fights start. And then we've had issues where we have challenges where some of the women have to seek medical attention, and then to take them to public institutions like the Mpilo or other institutions is a challenge, because now those hospitals are focusing mainly on COVID-related illnesses. So we found ourselves going to the private hospitals and paying for those women to be treated, which is a very unfortunate thing, where we are now overusing or overwhelming our health institutions due to the domestic violence, rather than making sure that maybe they get assistance with help. And that's why you are saying we are questioning the logic of the police officers, where someone comes in, you send them back and say, if you want this service from me, I need this amount of money, $55 for protection. And then that person goes back to the same environment, they get beaten until they raise that money. So those are the challenges that you are saying. We need our police service to be a service to the women who are in need of the protection. And then these are the regulations that we are still talking, negotiating with the minister to say they need to prioritize the service of protecting the women and their children. In terms, in other cases, it will be the children, the mother and the children being beaten.
Mm-hmm.
Okay, thank you. Over to you, Marvelous.
aiwa apo tiri kunzwa isu amai magodhonga mahlangu vachitaura ivo pamusoro penyaya yavari kuti iyo iri kunetsa munyika pari zvino. Vari kuti ivo uwandu hwevanhu vari kuwanikwa vachishungurudzwa panyaya kana kuti panguva ino yeCovid-19 hwakawanda, uyezve vari kuti madzimai vari kuwanikwa ivo vachishungurudzwa kana mwedzi wava kunopera, zvinoreva izvo kuti vanonge vakuzorohwa vachienda kuzvipatara nezvimwe zvakadaro. Uyezve vachitivo sangano ravo riri kubatsira kazhinji mukuedza kubatsira kuti madzimai aya vasawanikwe ivo vachizoshaya mari dzekuti vanorapwa. Asi vari kuti dambudziko guru nderekuti zvipatara zvizhinji pari zvino hazvisi kubatsira madzimai. Zviri kuti izvo zviri kuwanikwa izvo zvichiri kubatsira chete vanhu vane COVID-19 kana kuti chirwere ichi checoronavirus. Tiri ipapo regai tikutaurire zvakare kuti munyika pari zvino mune vanhu 885 vabatwa neCovid-19, 206 vakawanikwa ivo vachinaya mushure mekunge vabatwa nechirwere ichi, 670 ndo vane chirwere ichi pari zvino, uyezve 9 vakawanikwa vachishaya kubva kuchirwere ichi. Tombotarisa zviri kuitika pasi rose panyaya yedambudziko irori reCovid-19 tichitarisa kuti imo muno muAmerica zvakare mune chirwere ichi, uyezve ndosaka tiri kutepfenyura tiri kumba. Uyezve tichikutaurirai kuti pari zvino program yamuri kuona inoyi muchange muri kuiona munguva inotevera i-pre-recorded program, saka pamafigures apa munozokwanisa kuona zvinhu zvichisanduka panyaya yemamiriro akaita zvinhu. Tine vanhu 12 million vabatwa nedambudziko irori reCovid-19, 549,000 vawanikwa vachishaya, 3 million vakawanikwa ivo vachibatwa imo muno muAmerica, uyezve 132,000 vachiwanikwa ivo vachishaya. Asi time is not on our side, the star, so we really have to wrap it up. But would like to thank all those that watching, who watch our program, and also Star, you had a guest on the program, and I would also like to thank Dr. Simbiso Ranga, who was our guest here at the beginning of the program, who helped us to just look at the issue of COVID-19 and what's going on. If you can wrap up, Star, we are really out of time.
Yes, I was just chatting to Makoto Amashangu there. She just logged off, telling her, no, thank you, we are closing off anyway. She has been with us throughout. Thank you very much to Makoto Amashangu, Women of Zimbabwe Arise. She brought up very critical issues affecting women during this lockdown, and they are engaged in quite a number of projects now.
Yeah.
That even children, everyone is included. You can't separate women from their
exactly, children. Yes. Unfortunately, Star, we really have to call it a day. And, thank you so much, everybody. And let's meet again next time. Star.
Yes, I've already said good evening. Have a good evening, Zimbabwe.
Thank you, Zimbabwe. Let's meet again tomorrow on Let's Talk Ngati Kurukure. Good night.